Hello there, I'm back. So in this video, I'm going to discuss nursing care plan. This is actually yung shortcut ng nursing process. Dito yung ginamit ko yung ADPIE, Assessment, Diagnosis, Planning, Intervention, and Evaluation. I include also the different types of nursing care plan, types of medical assessment, how we're going to collect the data based on subjective and objective manifestation. In the nursing diagnosis, I include the prioritization based on Maslow hierarchy of needs, Henderson's 14 human needs, the ABCDE, and how to make a 3-part statement and 2-part statement in nursing diagnosis. The basis and how we're going to select it from NANDA, the component of nursing care plan based on SMART. So in the discussion, I include some sample of the NCP for students. I include focus charting and differentiate the student nursing care plan to staff nurse who's working in the hospital focus charting. I try to simplify, but it's a complete package for the nursing care plan. So please don't skip and finish my video. So bago tayo magsimula, let's review the nursing process. Ito yung defined systematic rational method of planning that guides sa mga nurses or in making a nursing actions and delivering holistic and patients-focused care to form a scientific reasoning and requires nurse critical thinking to provide the best care possible para sa patient. And doing this process is needs to identify the client's health status, actual potential problems, and we need to make or establish the best available caregiving evidence based on NANDA or ANA para ma-protect yung nurses against any legal problems, and also help the nurses to perform in a systematic, organized way to practice their profession. So meron tayong 5 steps. I use the ADPIE, Assessment, Diagnosis, Planning, Implementations, and Evaluation. So sa nursing care plan, it provides directions in individual, family, community to facilitate standardized, evidence-based, and holistic care. Meron tayong types of nursing care plan. Informal care plan, ito yung nag-exist lang on the nurse's mind, and the purpose for this is just to finish yung shift. But if it is called as formal, it is a written, computerized plan and organized and coordinates patients' care information and plan which can be accessed by other health team. Sa standardized, group of patients with classifications ng disorder, and there's a specific standardized care plans for that specific diseases. Individualized care, it's a care plan tailored for specific needs ng patient. Meron tayong tinatawag na 4 medical assessment regular perform on patients. First is the initial assessment. This is what we call triage. Ang purpose nito is i-determining origin, nature ng problem, and to use the information to prepare for the next assessment stage. So ito yung pinaka-most thorough phase of the entire process. Kasi dito nakasalala yung plan na gagawin mo para sa patients and how you're going to diagnose or making your nursing diagnosis. So the collections of the data that is needed is through medical history, physical examination, taking the vital sign by the underlying condition. After you gather your initial data, you need to try to check what is the most need ng patient. It should be based from your ABC or breathing circulation, yung critical status or that may endanger the life of the patient or emergency situations ng patient. So, doon ka mapo-focus sa assessment kaya tinatawag ko siyang focus assessment. Example, if the patient is having difficulty on breathing, or if the patient is in pain, or the patient is having hypertension. So you need to focus on the pathological and physiological manifestations that leads to an emergency cases or endanger the life of the patient. Sa time-lapse assessment, it is a medical conditions yung proper diagnosis and treatment after ng treatment, a few hours, week. So it's constantly evaluated yung conditions ng patients and compared to previous recorded parameter. Sa emergency management, it is performed during emergency procedure. You need to crucially evaluate the patient and assist on the ABC and identify the cause of the problem. So it needs an immediate manage to stabilize na yung condition ng patient, babalik na siya into a focused assessment. So that's the 4 types of assessment. So data collections or the signs and symptoms ng patient is very important as a baseline in how we're going to make a plan. Ang subjective data is yung symptoms that is specific to patient's problem and etiology na pwede mo siyang mag-gather through interview o yung that is the patient statement. Pag objective symptoms naman, that is the signs specific for patients na may problem. Pwede mo siyang makita through physical examination, health records, observations of the behavior, and can be supported by laboratory results. After mo mag-gather ang data, it needs to analyze. You need to cluster yung data. Pwede natin gamitin yung Gordon's functional assessment. You need to organize the data. You need to compare individual data with standard and norms. So kung halimbawa ang na-identify mo through assessment, patient is having difficulty on breathing. What are the support signs and symptoms indicating that the patient is having difficulty on breathing? Could be cyanosis, first loop breathing. So you need to look for the pattern. If there is a consistency, different cues to support your assessment data. So it means this is the baseline in order to formulate a nursing care plan. After the collections of data, we need to develop a nursing diagnosis. So ang reference natin ginagamit usually is NANDA, which is North American Nursing Diagnosis Association, which define yung clinical judgment about human response to health conditions, life process, or vulnerability that responds either in individual, family, group, or community. It is coming from the American Nurses Associations or ANA standard of practice, which provide impetus and support for the use of nursing diagnosis. So I'm going to give some overview how we're going to select or how we're going to choose the proper or right nursing diagnosis specifically for each patient's needs. Ang NANDA ay mayroong 13 domain and 47 classes, and it has 4 types of diagnosis. First is the problem-focused diagnosis. Patient's problem present during nursing assessment. It can be seen throughout the shift or patient's inter-hospitalization, but the focus is the manifestations of the patients that needs to be prioritized. Example for problem-focused diagnosis, it needs 3 components. Your diagnosis that correlates to other factors, and you need to define the characteristic, which is supported by the subjective and objective manifestation. Example of nursing diagnosis includes impaired gas exchange. So it is a short-term plan because it needs to address immediately. Hindi siya pwedeng maghintay in just a few minutes. It can lead to coma if there is decrease ng oxygen supply sa brain. So it is a problem-focused diagnosis and in a short-term plan. Risk nursing diagnosis, ina-apply ito yung sa may mga risk factors that require immediate intervention from the nurse or any healthcare team prior yung problem ma-develop. So one good example, if the patient is having nausea and vomiting and loose bowel movement, so yung patient is at risk for fluid volume deficit or fluid volume imbalance. This type ng diagnosis is often require rationale or it requires nursing judgment, and it should be correlated and associated with the manifestation. Health promotions and diagnosis. This is used to improve yung overall well-being ng individual, ng family, or community. Example, a group of patients with diabetes, sedentary lifestyle, modifications through health teaching. One good example of nursing diagnosis is readiness for enhanced knowledge. Syndrome diagnosis, it refers to a cluster of nursing diagnosis na correlated siya sa pattern ng manifestation na pwede mo rin siyang gamitin doon mismo sa subjective and objective data that you collected. So, example, If yung patient is mayroong difficulty on breathing because of decreased cardiac output for patients with congestive heart failure, it can lead to decreased tissue perfusions, and that is another nursing diagnosis. If kakaunti yung cardiac output from the left ventricle, it may lead to decreased tissue perfusions in the brain. It could cause an ineffective cardiac tissue perfusions or cerebral tissue perfusions. It's associated also of ineffective peripheral tissue perfusion. So sa congestive heart failure or CHF, there could be a syndrome diagnosis, which means based on each manifestation leading for its either left or right side heart failure, or pwede siyang gumamit ng maraming nursing diagnosis. And that is what we call syndrome diagnosis. So, paano gagawin yung nursing diagnosis? So, alam na natin kung paano mag-prioritize. So, paano mo siya gagawin? Ang nursing diagnosis, mayroong 3-part statement. Yung nursing diagnosis, problem, and related to. So, paano mo pipiliin yung nursing diagnosis mo? Sa NANDA, mayroon siyang 13 domain. Nandun lahat yun. At it's divided also with 47 stages. So, dapat makadevelop ng clinical eye para mas madali sa iyo ang pag-diagnose sa patients. Unang tingin mo pa lang, alam mong may manifestation siya, and this type of manifestation that falls into a certain pathological disorder. So, kung alam mo yung disease na yun at nag-aaral ka at ina-update mo yung sarili mo, mas madali. Example ng nursing diagnosis is decreased cardiac output. Related to what? Bakit siya nagkakaroon at bakit sinabi mo meron siyang decreased cardiac output? Dapat lalabas yung mga data na sinasabi mo, na pinoprove mo na meron siyang decreased cardiac output. Kung may decreased cardiac output ka, alin yung titingnan mo? Una, for yung perfusions reaching into the peripheral system, capillary refill is one good example. Blood pressure, heart rate ng patient, it's either tachycardia or bradycardia. For auto saturation, so dapat nakalagay yun sa data mo na masasabi mo, this is because of decreased cardiac output. At nagkakaroon siya ng decreased cardiac output related to what? Altered myocardial contractility. Okay? Pag sinabi kong related to what? Related to impaired or altered myocardial contractility. Trying to identify the problem plus yung etiology or related factors or probable cause. May kadugtong siyang secondary to. Ang secondary to, ibig sabihin dahil ito ay cause ng ganitong disease. Example, sinabi kong decreased cardiac output related to altered myocardial contractility secondary to myocardial infarction. Pwede ka rin gumamit ng AMB or EAB para ma-define yung characteristic or para ma-supplement yung diagnosis mo. What is AMB? That is manifested by, or EEB as evidenced by. Parehas yun. So, i-define mo lang yung characteristic based on the sign and symptoms para ma-support yung diagnosis. So, i-add mo dun kung ano yung mga symptoms na nakita mo based on the data that you gather. Pero pag gumamit ka ng diagnosis like risk for activity, intolerance related to pain. So, that 2-part statement lang siya kasi direct siya sa potential problem. And the first problem, 3-part statement ang kailangan mo. Pag risk lang siya, direct to the point or direct to the potential problem. After we classify on the different types of diagnosis, we need to set the priorities. So, sa prioritization, it is very important that we need to rank, regroup, classify the manifestation. If it is life-threatening problems, it should be prioritized. So, in setting your priority, we need to use as reference is the Maslow hierarchy of needs. Kasi si Maslow, in-identify niya yung mga needs na kailangang i-prioritize, which is you cannot live without water, oxygen, yung airway if there's some obstructions. So its focus on the first level is more on the ABC, airway, breathing, and circulation. So, dito pa lang, alam mo na kung alin yung ipaprioritize mo. If ito ay lumabas dun sa mga collected data mo, it means na ito yung priority. Next level is safety and security. So, nandun yung injury prevention, if patients needs to be isolated, if the patients need some precautions in order to prevent some complication. So, dun siya pumapasok sa second level ng hierarchy. So, hindi ko na kailangang i-discuss yung different level, the basic physiologic needs, safety and security, love and belongingness, self-esteem, and self-actualization. So I'm just trying to discuss and give you some idea how you're going to prioritize. Next is using another reference, the Henderson 40 needs that applies also to Maslow hierarchy of needs. So dun kay Henderson, meron 14 needs, but you will notice that it is almost the same with Maslow hierarchy. Yung first level niya is, ng needs niya, is also focusing on the first 2 or 3 level is focusing on the basic needs, the airway, breathing, and the circulation. So, doon pa rin halos parehas din siya. Mas marami lang yung kay Henderson, and it includes also the health values, the beliefs, the priority, and resources available in urgency ng factors na need ng isang client. It's assigning more on the priorities kasi. Ano ba yung kailangan ng patients or ng client in the process to enhance or prevent further complication. Isa pang mas madali para ma-assess mo yung patient on what is your priority is using the ABCDE. What is ABCDE? Airway, breathing, circulation, disability, and exposure. So this is a systematic approach para sa immediate assessment at treatment ng critically ill or injured patients. So it is being used in all clinical emergencies. So sa prioritization, mas madali itong siyang gamitin. A stands for airway. So that is first, assess for life-threatening airway problem. Example na choke yung patients or there is an obstruction causing for inability to breathe. So, example yung patient, meron siyang secretion. So, ineffective yung gas exchange. Or yung patients mayroong vasoconstriction sa lungs. So example, yung patients mayroong pulmonary edema resulting for unalterations ng carbon dioxide and oxygen supply. How about the circulation? Paano mo i-assess yung patients na may alteration sa circulation? Example ay mayroong hypertension or mayroong edema, pedal edema yung patient. So altered ang circulation. Pag ang heart mayroong problema, mayroong arrhythmias, may dysrhythmias, there is a fast heartbeat or tachycardia or bradycardia, there is abnormal breath sound. So mayroon siyang alteration sa heart, poor ang kanyang capillary refill, and poor din ang kanyang ABG or even yung kanyang autosaturation. So, sa disability, if yung patient is unresponsive, or yung alertness ng patient, yung voice responsive, yung pain responsive, if yung patient is mayroong impaired physical mobility or meron siyang impaired bed mobility, or impaired walking. Yun yung mga sample ng disability. Sa exposure naman, if yung patient merong frost, meron siyang burns, ito yung nakafocus ang assessment sa skin color ng patient. Using the ABC, ang tinitingnan dito is more on identifying life-threatening problems and institute yung treatment to correct it. So this is how we are going to choose what is your priorities. So just a recap, we're going to use the Maslow hierarchy of needs, Henderson's 14 human needs, and the ABCD, focusing on the life-threatening problems and needs of the patient. Nursing care plan. After ma-identify yung priority and you make your nursing diagnosis, the questions is, what is your goal or what is your desired outcome or expected outcome for the patient? Based on your nursing assessment in your priority, the first questions is your goal is a short-term or a long-term goal? Pag sa mga ICU, short-term goal siya lagi. So it needs to address immediately in a minute or in an hour. Pag long-term goal, yun yung mga patients na may chronic problems. So yung goal mo, nakafocus siya sa problem prevention, resolution, and rehabilitation. So yung expected outcome mo or your plan should be based on SMART. Specific, measurable, attainable, realistic, and time-bounded. There are components of goals and desired outcomes sa nursing care plan. Merong subjective na tinatawag. This is focusing more on the client, kaya nga client-centered, trying to assess some of the attributes. It's either yung psychological condition ng patient, vital signs ng patient, and other manifestation. So it's not focusing on the nursing interventions or the nurse per se. It should be patient-centered. Next is there should be a verb. That is the actions or specific actions that clients needs to be performed, to do, or to learn. Conditions and modifier, these are the what, when, where, or how, which added to the verb to explain yung circumstances. Paano gagawin yung expected outcome. Sa criterion of desired performance, ini-indicate niya yung standard. What is the expected performance that needs to be evaluated or paano mo maa-assess na yung plan mo is met or successful. Ito yung criteria na nag-indicate kung ano yung standard na kailangan mong i-check or evaluate after the end of the nursing intervention. So, you can start by making your nursing care plan as the client will demonstrate. So, the goal is focusing on the client behavior in response to the treatment. It should be observable, it should be measurable terms ng outcome. So, pwede nakalagay doon yung expected hours. Like, example, iniligay mo, after 8 hours of nursing intervention, the client will demonstrate. So, it is measurable. So, yung terms of outcome mo should be clear and realistic, especially sa mga short-term plan. So, yung plan nakafocus siya sa isang nursing diagnosis that can facilitate the evaluation of based on set nursing intervention. Example of nursing care plan. At the end of 8 hours of nursing intervention, the patients will demonstrate adequate cardiac output as manifested by acceptable vital sign and minimize symptoms of congestion. So, component of goals and desired outcome, patient is the subject, demonstrate is the verb, adequate cardiac output is the conditions or modifier, and the criterion is acceptable vital signs and minimize symptoms of congestions. So if you're still here in my channel and you're still learning in my discussion, I think it deserves the like and please subscribe so that you will be notified naman on my next video. Next is implementation or nursing intervention. Putting plan into action and performing the planned intervention. Nakafocus ka sa patient and you're trying to support the patient in achieving the goals. So based on your goals and based on the data that is being collected, you need to make an outline care plan. And it should be evidence-based practice. So ang nursing interventions are classified sa 7 domains: family, behavioral, complex physiological, community safety, and health system intervention. Kaya it is called as evidence-based, patient-centered, and holistic approach. Mayroong 3 types of nursing intervention in the NCP: independent nursing intervention, dependent nursing interventions, and collaborative nursing intervention. Sa independent nursing interventions, from the word independent, ibig sabihin yung nurse alone, ikaw lang. So alam mo yung trabaho mo, the activity ng nurse with sound judgment, knowledgeable, you have the skills in how you're going to assess, in how you're going to support yung patient, comport the patient, and all the bedside care that needs to be done, and making referrals to other healthcare professionals. Take the vital sign, dinocument mo yung interventions na ginagawa mo, you do the physical examination at some of the bedside care. Sa dependent nursing intervention naman, yung mga activities like yung you carry out doctor's order, it includes yung diagnostic test, treatment, yung diet, administrations of medications as part ng dependent nursing intervention. Pag sinabi mo naman na collaborative intervention, nakikipag-collaborate ka with other health team members. Example, sa dietitian, referring to the attending physician, sa social worker, or sa therapist. That is collaborations or collaborative intervention. Or asking for other healthcare professional for professional viewpoints on the conditions ng patient. So sa nursing interventions, dapat kinoconsider yung safe and appropriateness for client. Example, sa age ng patient, yung medications mo ba, yung health and condition ng patient, yung time available, yung resources, yung cultures and belief ng client, specific and clearly stated. It starts with action verb. Ano yung kailangan gawin ng nurse? Ano yung intervention, and it must be precise. Nandun yung qualifier, how, when, where, and the time and frequency, and the amount that will provide in the content ng plan. Next is the rationale. It is known as the scientific explanation that explain why the nurse intervention was chosen for that certain diagnosis or intervention. Bakit kailangan mo yung gawin? It does not appear in regular plans. It may be based on the conditions of the client. It may be based on the pathological or physiological principle within the selected nursing intervention. So you're trying to justify why you need to perform such intervention. And the last one is the evaluation. As of the date and time, so if tinitingnan yung expected outcome, yung status, if yung goals is met, partially met, or not met, actual conditions ng patient, if it's unmet or partially unmet, there could be a revision ng care plan, there could be a reassessment and making of nursing diagnosis, expected outcome, intervention, and communications and documentations. So there is a re-evaluations of expected outcome with time frame. So hindi na siya yung regular na ADPIE because of the reassessment. And of course, yung planning mo mag-change or yung goals mo mag-change and the intervention. So that is the ADPIE that covers the nursing process. I give you an idea in how you're going to formulate the nursing care plan. On my next video, I'm going to discuss sample of the nursing care plan based on these discussions, which I'm going to include NCP for students. Thank you for watching. I hope you learned something. This channel provides information, lectures, and discussions of different pathological disorder. Disclaimer, intervention and management may vary according to the actual situations of the patient. So learn more, be efficient, and be an angel in the sick room. Don't forget to like, subscribe, and comment. I'm your nurse on duty. Until next time.